Rescue 917, you're dispatched to 1455 Crest Avenue on a 62-year-old male, altered mental status.
Alright. BSI is my scene safe?
Yes, your scene is safe.
Alright. Do I see any hazards at this time?
No hazards at this time.
Alright. Is this my only patient I have?
This is your only patient.
Alright. Where is my patient located?
He's located in his chair.
Alright. So my environment is it's nighttime and my patient's inside his house, okay? As I'm walking into the patient's house and stuff, I'm looking. And I see over here on the end table an insulin vial and an empty syringe. So I'm thinking probably he's a diabetic, he's probably took his thing. Just based on him being an altered mental status, I want to go ahead and get Jersey County Sheriff's en route.
Sheriff's Department has been dispatched and is en route.
Alright. So as I'm approaching my patient and everything, I see what appears to be a 62-year-old male patient, weighs approximately 230 pounds. Sir, can you hear me, sir? So he's learned to verbal, and he's talking to me, so I know his airway is intact. And I don't see any injuries to his airway right now that may compromise his airway. For his breathing now, we're going to inspect the chest and look at the chest and inspect it. And what we're looking for is we're looking for any flail segments or anything like that. So we're going to feel and palpate the chest. So now I'm going to listen to some breath sounds. Alright, his breath sounds are clear bilateral. So I'm going to check his pulse now. He's got a good pulse. It's strong. It's perfusing good. So I know he's got at least he's got a regular pulse. So I know he's got at least a blood pressure of 90. So his skin looks a little cool and clammy and everything. It's sweaty. So make a note of that. So now, based on this and everything, now I'm going to check my Glasgow Coma score. Sir, can you talk to me, sir? He's talking to me, but he's not really making sense. His eyes are open, spontaneous, and he flexes away from pain. So based on this, I give him a GCS score of 11. So we're going to check the pupils too. Pupils are equal around reaction to light. So based on this information and him being altered mental status, not quite sure what we got going on right now, we're going to make him a critical patient and let him go. So while my partner's in the back of the ambulance getting everything started, I'm going to go ahead and get my partner to take some vitals. I'm going to get him to do a blood pressure, a pulse, a respiratory rate, and what he's satting, and go ahead and get me a D-stick while I get some information from the family right quick. Can y'all tell me some signs about what was going on with him when y'all found him?
He came home, said he was not hungry, took his blood sugar, then took his insulin, and sat in his chair.
Okay. Does he have any allergies to any medications?
No allergies to medications.
Does he take any medications?
Just his insulin for his diabetes.
So what type of past pertinent medical history does he have? What type of medical history does he have?
Just diabetes.
Just diabetes? Okay. What was his last oral intake?
He had lunch.
All right. Events leading up to this was you said that he came home, took his insulin, and didn't eat. So that was the onset was he took his insulin and didn't eat. So as far as the OPQRS goes, we just need to know about time. How long ago did this start?
About 20 minutes before we called you.
Alright. Okay, so, and what hospital does he use?
St. Vincent's, Birmingham.
Alright. So now that we're in the back of the ambulance and stuff, I'm going to go ahead and get my vitals from my partner. What was his blood pressure?
His blood pressure was 142/98. His pulse is 82. His respirations is 12. His SAT is 98. He has no pain, and his blood sugar is reading low.
Alright, well, based on that stuff, we're going to go ahead and start an IV on him. We're going to do an 18 gauge because we're going to give him dextrose, 25 grams and 50 milliliters. We're going to go ahead and push that rapid and then push it, give him some fluid. Then we're going to give him thiamine, 100 milligrams of thiamine. So, now that we've done all that and stuff, my patients just start coming back around as we're en route to the hospital. Sir, can you hear me, sir?
Yeah, yes.
Alright, so we're going to go ahead and check his blood sugar now that he's come back around and everything. We check his blood sugar again and it tells me it's up to 100 now. So we're pretty good on that. Yeah, so just to make sure it was just low blood sugar and everything, we're going to go ahead. Sir, just to make sure you just had some low blood sugar problems, so we're going to go ahead and do a detailed physical exam on you, sir, just to make sure that's all it was, okay?
Okay.
Alright, so we're going to start up here at his skull, check his skull, feel around, and see if he's got any vital signs or anything like that, which he doesn't. I'm going to feel his cheeks and his jaws, okay? I'm going to check his pupils, make sure his pupils are still pearl. They are, which means pupils are equal around reacted to light. I don't feel anything wrong with the nasal cavity. Sir, can you stick your tongue down and go, ah? Alright, so his tongue looks good. I'm going to feel this neck for his lymph nodes. Okay. No pain back there. Okay. So there's no need for us to take any spinal precautions or anything like that. Alright, sir, I'm going to just inspect your chest now, sir. We're going to inspect it, feel it. We're going to percuss it. Alright, so now we're going to listen to, I'm going to go ahead and listen to breath sounds in his heart. Breath sounds are clear but louder and his heart sounds good. We're going to go ahead and hook you up to the monitor, sir, and do a 12 lead on you, sir. So, now we're going to assess his abdomen, inspect it. We're going to percuss it. We're going to palpate it. Then I'm going to listen to gastric sounds. And we have gastric sounds okay. We're going to inspect the pelvis, feel the pelvis, make sure it's good. We're going to check the lower extremities, inspect them. No surgeries in your lower extremities, right, sir?
No.
Yeah. Can you feel that, sir?
Yes.
Alright, can you push down? Alright, he's got good PMS in there. We're going to come up here and check his arms, upper extremities. He's got pulse. Can you feel that?
Yes.
Alright, you did. He's got good pulse motor circuitry. Now we're going to move on to my next exam, sir. So my mental exam. So my appearance is that he's dressed. Sir, what type of mood are you in, sir? You're not depressed or nothing like that?
No.
Okay. And he speaks well. You're not thinking of any type of harming yourself or anything like that? Okay. So now we're going to talk with the patient about his neurological status. We're going to check and make sure you haven't had a stroke. Sir, I want you to we're going to lift your arms up, and when I let go, I want you to hold them for me. Alright? Put his arms down. Can you smile for me? Alright, so he hasn't had a stroke. Everything looks good. We've inspected him. Everything. Based on this information, everything, we're going to continue to transport to St. Vincent's, Birmingham. And I've reassessed the vitals since he's stable about every 15 minutes.